Good morning guys, I'm Josh McCullum, osteopath and personal trainer at Good Health Centre, and as promised here is going to be part 2 of the rugby injuries. So the first one that we're going to talk about is going to be the muscular aspect of rugby injuries. As mentioned, 40% of injuries, they are muscular in origin, so this can either be muscular tears, muscular strains, muscular contusions. As you can imagine, brutal sport like rugby, contusions, which is bruising, is going to be fairly common all over the body. The muscular strain, which is most common, is going to be the hamstring. So the hamstrings consist of 3 muscles. The 3 muscles, your semimembranosus, semitendinosus and biceps femoris. This is your pelvis, and they all attach to the back of your pelvis into your ischial tuberosity or your sitting bones. They then attach into 3 separate parts into the back of your knee. This is most common in the mechanism where you are either kicking, so fly half position, or full back, whoever it is that's kicking the ball. And the other one is actually during sprinting. So when the hamstrings become injured, you can either find that they get micro tears, which you can find is similar to DOMs in the gym, or you can find that the injuries become much more significant, in which case you're going to be getting full-on tears. Symptoms that you get is pain with walking, pain with bending your leg, pain with straightening your leg, bruising. In the initial stages, unless you've got a big bruise there, you may find that the symptoms are quite generic. However, your physical therapist should be able to do some special tests to figure out what it is that is exactly injured. There is an association between hamstring strain, but then also damaging the inside of your knee. So the inside of your knee, the medial collateral ligament, is again one of the most commonly injured structures whilst playing rugby. And there is an association between injuring this medial collateral ligament and the medial meniscus, which is the cartilage within the knee as well. For what your physiotherapist, osteopath, chiropractor, sports therapist can do for you, they'll be looking to improve your range of motion, reduce the inflammation to start with, but the long term is to make sure you increase the strength, not just in smaller range of motions, but to increase the strength in the area where the muscle is then susceptible to re-injury. So this is why it's important to make sure that you do follow through with your physiotherapist, your osteopath's advice, and make sure that the injury is then rehabilitated correctly.